there seems to be quite a bit of consensus on these steps. We're certainly going to seek their continued support. The healthcare industry is obviously one of the most important in the state, and we want them, and they have been, at the table as we move forward. I think the advantage for them is that you will have an opportunity to cover more, tens of thousands of more Iowans, which I think is pretty attractive to those private providers in terms of their bottom line. And I want to commend the healthcare industry. I know that Commissioner Voss has done a really good job of bringing them to the table, and we're thrilled that they have been so actively engaged in this commission and its work.
One follow-up on that, if it's covering more Iowans, is an advantage to them, why haven't they been doing that?
Well, because there are current rules of the game, if you will, that preclude certain people like Kyle from getting coverage. So we're trying to level the playing field and change the state law in terms of those, how we treat individuals like Kyle that currently are kind of left out of the equation.
The four approaches you outlined did not address the situation when businesses providing health care to their employees or not. States such as Massachusetts have addressed that. Why didn't you address it?
Well, that was certainly discussed, and that might be a part of the long-term plan to get us to 100%. But right now, we've really looked at a few easy steps to take that we believe there could be quite a bit of consensus on in terms of expanding healthcare. And we want to make this a public-private partnership. We're not interested in being unreasonable, if you will. So this is a long-term strategy. We think it's fair. Again, as I said in my comments, we think it's common sense legislation, and we believe we can get the support of Iowans and the insurance industry on most of these proposals, if not all.
Is it your anticipation that at some point the federal government will come forward with the universal health care plan, or are you just assuming that as a state you're going to have to deal with this?
Well, I think kind of a combination. We expect there will be some real reform in Washington, D.C. starting next year in terms of health care and making it more accessible and affordable to Americans. That's another reason we're not maybe going as far as some other states here, because we believe that these steps, combined with what we've already done and the likelihood of Washington taking some pretty drastic steps in the right direction next year, will enhance our ability to cover more Iowans. And we didn't want to box ourselves in, if you will, by coming up with some state mandates that the feds ultimately might trump, if you will, or overrule. So this, I think, given the climate, makes a lot of sense to move forward in this manner.
Is the state going to have a cost in creating this electronic records council?
Yeah, I can get you the exact dollar amount. It's in the budget right now. The great news is that the Iowa Hospital Association and Iowa Health Systems have recently received a large federal grant to help on a statewide electronic records management initiative. We will be a part of that effort, and that will help us in terms of the cost.
Governor, has the state ever considered a self-insurance program? I think some communities are already doing something like that.
You know, there have been a lot of really interesting ideas put on the table, but these proposals that I've focused on today really come out of a lot of hard work and effort that the commission put in. And again, we think of the options, of the entrees available right now. These steps make the most sense. There's been all sorts of reinsurance proposals and different mandate ideas and things like that. But we're just taking this kind of one step at a time, and believe if we can get this legislation passed this session, we will be setting ourselves up for accomplishing our goals in the future.
Is there sort of a go slow message in this to lawmakers upstairs who are fashioning a program that appears to be more expansive, that does deal with getting universal care, that does deal with mandates?
No, we encourage the legislature, to continue to push the envelope, if you will, to push hard. But we have one of the co-chairs of the commission here, Representative Faggy is here. He supports the proposal I'm rolling out, as does the overwhelming majority of the members of the commission. So, and we appreciate the fact that some of them are here as well. Again, we're trying to come up with a common sense game plan, if you will, to move forward. And we believe if we can get these goals accomplished this session, we'll be moving in the right direction. That doesn't preclude us from doing a few other things that the legislature will continue to debate and discuss on healthcare this session, and I, again, encourage that kind of debate.
Can you assure Iowans that some of these mandates won't lead to higher insurance premiums?
Actually, you're talking about people like Kyle that already have, if they're lucky enough to have a coverage at all, because they've been penalized, if you will, for pre-existing conditions. Their rates are higher than they should be. So we expect that rates overall will come down. You're going to have more people covered, a larger pool, and most importantly, you're going to offer health insurance to tens of thousands of people, young and old, that don't have it today. That's a pretty good combination. Again, we've given a lot of thought to this proposal, and we're not interested in raising rates. We're interested in lowering rates, making it more affordable and accessible at a reduced rate. Thank you all very much.